The H5N1 bird flu virus has sickened chickens and dairy cows across the state. Store shelves have been emptied of contaminated dairy products. We know the virus is able to jump from one species to another, so will widespread human infections be next? Suzanne Russ covers environmental issues for the LA Times and joins us now. Suzanne, it's always good to see you. Thanks for being here.
Hi, Lisa. Great to be here.
Tell us where we stand in this outbreak right now.
Yeah. So I quoted somebody the other day who said something like to the extent that we are swimming in virus right now. It is everywhere. It is in wild birds migrating from the Arctic. It's in commercial poultry. It is right now in over 500 herds in California. That's more than half of all the dairy farms in the state, and it's more than 720 nationwide. I think we're in 15, maybe 16 states at this point. So it is everywhere. It's gotten into people as well. I think since March of 2024, 61 people have been infected with H5N1 in the United States, including recently 2 children in the Bay Area, one in Alameda County a few weeks ago. And just over the weekend, news broke that there was a child in Marin County who has also been exposed. It is unclear what their symptoms are. The child in Alameda, it sounds like it was mild. There's no information out yet about this child in Marin County.
The majority of the people who've gotten sick, though, work in the dairy industry, right?
That's right. More than almost all of the people in California, save these 2 children, have worked in the dairy industry, and they've gotten it just by being around infected cows. I mean, as we talked just a few seconds ago, there are so many infected herds in the state. It's not surprising that dairy workers are going to pick it up as well. And it's a messy job, right? They're in a milking parlor. Here I am doing the weird hand thing, but they're getting milk in their eye, up their nose, on their face. They get on their hands and then touch their eyes. So, multiple routes of exposure.
So what does this new research say?
So there was new research that came out last week. It was published in the journal Science. It's out of Scripps Research Institute down around San Diego. And they were looking at the virus itself. And what they did was they sort of centered on, as we talked about, this virus is called H5N1. And the H is a protein. It's called hemagglutinin. And on that protein, there's a genetic sequence. What they were able to do is tweak just one amino acid, so just one genetic change that would turn that virus into one that really sort of locked in on bird cells and instead onto human cells. So sort of the long and short of it is we are one genetic mutation away from this being a virus that likes people's cells.
Well, I hate to use the P word, but pandemic. Is there concern that if that happens, we could face what we faced before?
Yeah, there's a lot of concern about it right now. And particularly when you consider the fact that very little is being done to stop it. We spent time, Melissa Gomez and I spent time in the Central Valley going to dairy farms, and PPE is not really being worn. So, people are not protecting themselves against this in the way I think most health officials, if they could rule the world, would want to see it. And we're just approaching human flu season. And the real concern there is that somebody who is carrying a human flu could then be exposed to this bird flu. Within them, these 2 flus, one researcher calls it virus sex, could go and, sort of switch genes and create a new super flu. So there is a lot of concern right now.
I know the USDA has called for all the raw milk products out there to be tested. Will all of our milk supply be tested? What's the government doing to protect us?
Yeah, so when they say raw milk, they're not focusing just on like raw farm, for instance. What they're looking at is sort of right after milk has been pulled from cows and different herds and put into these bulk milk tanks. They will test that tank, that bulk milk tank, before it gets pasteurized to see whether the virus is in there. So they've said they're going to do this in every state, but they're starting with just a subset of states, which include California. 4 of those states are already doing this. It's unclear when the rest of the states will do this. The idea is that it will give us an idea of where the virus is in the U.S. dairy herds. But right now it's a little perplexing.
Back to the raw milk, because there are some people, RFK Jr. being one of them, that were proponents of raw milk. As I understand it, they've asked for a voluntary recall of those products.
That's correct. So Raw Farm is the largest producer of raw milk in the state of California. The owner, Mark McAfee, has something like 1,800 head of cattle. He has voluntarily recalled all of his milk and cream products, and the state has suspended all sales until he is out of quarantine and the virus can be shown to be gone. But the real concern is the virus in raw milk is live. When it's pasteurized, it's inactivated. So there's concern that people are consuming a product that's filled with live virus.
Suzanne Rust writes about environmental issues for The Times. Suzanne, thank you.
Thank you for watching our YouTube channel. For more stories in your communities, click the subscribe button right here. You can also download our app or watch us on TV for the latest information, balanced coverage, weather updates every 10 minutes, and more. We'll see you then.